Hi guys, as some of you may know, my husband and I have been trying to get pregnant for quite some time now. We've not had any luck. We've had 2 miscarriages, and it's been kind of difficult. I'm 35 years old now. Although I do have children, age seems to be a huge factor this time. I ovulated 7 days ago, and I'm getting ready to do some lab work at home. I have the proper equipment and a centrifuge, and I'm going to draw my blood, take the serum, and do a couple of different pregnancy tests. Now, the pregnancy tests are supposed to measure as low as 10 MIU. So I'm hoping that maybe I have enough HCG in my blood if I'm pregnant this time that it will pick it up. But if not, in the next 48 hours, if I am pregnant, I will have enough HCG in my blood to show up on a pregnancy test. So if it is negative today, I will do a follow-up again tomorrow, and then again the day after. If I do not have a positive test in 2 days, then I will know that I am not pregnant once again this month. Last month we did not get pregnant. The month before we did get pregnant, and 2 months prior to that we were also pregnant. And the pregnancies all seem to be chemical related. Very early pregnancy loss. So hopefully this gives me the result I want, so I don't have to do some more testing in the next 2 days. So I will let you guys sit back and observe. A little alcohol pad. I'm going to clean the area. Dry the area a little bit. Otherwise the alcohol will make the injection site burn a little bit. Now, you always make sure that I don't know if you can see the needle. Let's see. I don't think it's going to focus, but the needle needs to be where the opening is at the top, and just slowly inject it into a good vein. And if you're in, blood should start flowing in pretty easily. As you will see, it is starting to fill up. And there is the sample. Now normally you will pull the tube out before you take the needle out, but I find it just as easy, and I don't have hardly any blood loss. Okay, I have put the blood sample in the centrifuge. You could probably hear it spinning right now. I will let you know what the results are as soon as it is done. I may even be able to show you the test processing. Okay, I'm back. I'm waiting for the blood to finish the centrifuge process, and once it is done, I will apply the serum to the pregnancy test, and I will let you know the results. Okay, as you can see, the serum is now separated from the blood, and I can go ahead and perform the test. And I do want to point out that drawing my blood, I don't know how well you can see that, all I have is a little red dot. When I have other people draw my blood at a lab, I always bruise right away. So I find it more soothing to draw my own blood at home. Okay, now that the blood is separated from the serum, as you can see, nice and clear, kind of a hay color, I will go ahead and do the HCG test and we'll see what the results are. I have to say I'm not feeling very optimistic this month either. And so far they're both looking negative. I am starting to see a second line on this one. I don't see a second line on this one, but I am certainly seeing a second line on this one. It's really, really faint. I don't know if you're going to be able to see it or not. If you can see it or not, I'll have to wait until it finishes. I'm going to grab another one just to make sure it's not a fluke. I'm going to run a second test now and hope that it's positive too. The Osom brand is still negative. Well, guys, that's why I always take several tests, because every once in a while you do get a bad one out of the bunch that will give you a false positive. I did take 2 more, and both of those were negative. It's heartbreaking. I just look at these tests and they're always negative. And even when they are positive, they're not positive for very long. I do have a cyst in my left ovary that we're supposed to be taking a look at again next month and possibly removing it, which could be affecting my ability to get pregnant this time and stay pregnant. I do have endometriosis. We don't know how severe it is. We will be taking a look at that next month as well, and then we'll have a better idea of where we sit. I was really hoping that I would get that positive today. Been looking really forward to it. Just to see the first one turn positive and then the other ones were negative. It's not what I was looking for. It's not what I wanted today. Now, can you use a first signal pregnancy test? This is an over-counter pregnancy test for use with blood? I don't think so. I think these are only intended for urine. But I am going to do a test with my serum and we'll see if it turns positive. If it does in fact turn positive, we will know that you cannot use blood on these tests for an accurate result. I mean, sure, you can use blood on the test, but it may not be accurate, is what I mean. So, we will see what the results say. Well, I guess that shows what I know, because this test is very much negative. If I can get that to focus. There we go. There is not a second line. So, I guess you can use these for blood and it will be accurate. But that is definitely negative. There are not 2 lines. So, here you have it. You can use blood on the first signal pregnancy test from Walmart. Who would have thought? So I guess there are some over-the-counter pregnancy tests that you can use your own blood on. I have the QuickView Plus in the Osam brand. When you're not pregnant, they're negative. These are intended for blood and urine.